Welcome to Pharma Notes. Let us learn about cholinergic transmitter and synthesis, release, and storage of acetylcholine, and some important points of muscarinic and nicotinic receptors. So, first, synthesis of acetylcholine. ATP plus acetate plus coenzyme A that forms acetyl coenzyme A and acetyl coenzyme A plus choline in the presence of enzyme CAT, that is choline acetyl transferase. This forms acetylcholine. Acetylcholine is synthesized locally in the cholinergic nerve endings and it is stored in the vesicles. These are the vesicles where ACH is stored and it is released in the synapse. In parasympathetic system, acetylcholine is a principal neurotransmitter and it is secreted by preganglionic as well as postganglionic fibers. Therefore, it is also known as cholinergic nervous system. So the acetylcholine is synthesized from acetyl coenzyme and choline, and thus it is stored in the cholinergic neurons. Here we can see the structure of acetylcholine. Now let us see the cholinergic neuronal mechanisms. So this choline plus CAT, that enzyme choline acetyl transferase, this enzyme forms ACH. This ACH is then stored in the vesicles and then it is released in the synapse. So ACH in the synapse, it is metabolized by the enzyme acetylcholine esterases and it forms choline plus acetate. Then this choline is again uptaken by this choline carrier in the neurons and again it is reused to form ACH. So when the nerve impulse stimulates the neuron, the ACH is released in the synaptic cleft here and it stimulates the postganglionic as well as preganglionic receptors and produces the response. The uptake of choline by the neurons is rate limiting step in the biosynthesis of ACH. So this choline which is uptaken by this choline carrier is rate limiting step in the synthesis of ACH. Now the choline uptake, which is rate limiting step, that is inhibited by drug hemicolinium. Hemicolinium inhibits the uptake of choline. Next drug is vesamicol, which inhibits the transport of ACH into the vesicles. Therefore, this step is inhibited by vesamicol. Next is botulinum toxin, which inhibits the release of ACH in the synapse. Anticholine esterases, for example, neostigmine, that inhibits this enzyme acetylcholine esterases and thus it prevents the metabolism of ACH. Other drugs are non-depolarizing blocking agents, example tobocurarine. Depolarizing blocking agent, example suxamethonium. Muscarinic receptors and subtypes. So there are three types of muscarinic receptors: M1, M2 and M3. So this is location of M1 receptor at CNS, autonomic ganglia and gastric glands. Next, M2 receptors, which are located on heart, and CNS. M3 receptors location bronchus, eyes, GIT, CNS, urinary bladder and glands. This is location of M3 receptors. Now let us see the characteristics of important subtypes of muscarinic receptors. We have seen location. Now we will see in detail function, nature, mechanism of action, agonist and antagonist. So M1 receptors, they are present at autonomic ganglia and function is depolarization. At gastric glands, it increases or it stimulates the release of histamine and acid secretion. At CNS, the function is learning, memory and motor functions. Nature is GQ protein coupled. Transducer mechanism IP3 DAG, which increases cytosolic calcium. Phospholipase A2 increases PG synthesis. Agonist of M1 receptor is oxytryptamine and antagonist of M1 receptors are pyrenzepine, telenzepine. Next is M2. M2 receptors are predominantly present on the heart. So at SA node, it causes hyperpolarization, decreases rate of impulse generation. At AV node, decrease velocity of conduction. Atrium, shortening of action potential duration, decrease in contractility. Ventricle, decrease contractility slightly. At cholinergic nerve endings, decreases release of acetylcholine. At CNS, the function is tremor, analgesia, visceral smooth muscle contraction. Nature is GIGO protein coupled. Transducer mechanism is K plus channel opening, which decreases CAMP. Agonist is methacholine. Antagonist of M2 are methocatamine and tryptamine. Next are M3 receptors. They are located at visceral smooth muscles, which causes contraction of smooth muscle. Location on eye, iris, it causes constriction of pupil, meiosis. Ciliary muscles, contraction. At exocrine glands, the function is secretion. It stimulates the secretion. At vesicular endothelium, release of nitric oxide, which results in vasodilation. The nature is GQ protein coupled. Transducer mechanism IP3 DAG increases cytosolic calcium. Phospholipase A2, which increases PG synthesis. Agonist of M3 is bithanicol and antagonist of M3 receptor are solifenacin, darifenacin. Next are characteristics of subtypes of nicotinic receptors. There are two types of nicotinic receptors, NM and NN. Location of NM, neuromuscular junction. It causes depolarization of muscle end plate, contraction of skeletal muscles. Nature, it has intrinsic ion channel pentamer of alpha 2, beta or gamma and delta subunits. Each subunit has 4 TM segments. Transducer mechanism is opening of cation channels, sodium potassium channel opener. Agonists are PTM and nicotine. PTM is phenyl trimethyl ammonium and antagonist of NM receptor is tobocurarine and alpha-1 neurotoxin. NN receptors, location at autonomic ganglia, depolarization, postganglionic impulse. At adrenal medulla, that it causes release of catecholamines. CNS function is site-specific excitation or inhibition. It has intrinsic ion channel pentamer of only alpha or alpha-beta subunits. Each subunit has 4 TM segments. Opening of cation, sodium, potassium, calcium channels is transducer mechanism, and agonists are DMPP and nicotine. DMPP is dimethyl phenyl piperazinium, and antagonists of NN receptor are hexamethonium and trimethophan. Muscarinic actions. First, heart. It has inhibitory effect on heart via M2 receptors and negative chronotropic and bromotropic effects, that means decrease in heart rate and decrease in conduction. On blood vessels, there is no direct cholinergic supply present, but the M3 receptors which are present on endothelium of blood vessels, it causes stimulation of this receptor and release of nitric oxide from endothelium, which results in vasodilation. Muscarinic actions on eye. It stimulates the sphincter pupilla, circular muscles of eye, and results in meiosis. This action is via M3 receptor. ACH also causes contraction of ciliary muscles of eye. In this image we have seen here, it causes meiosis. Muscarinic agonist and anticholinergic causes contraction of sphincter pupilla. Anticholinergic drug results in mydriasis and loss of accommodation, and that is blur vision. This is mydriasis, which is caused by anticholinergic drugs or antimuscarinic drugs, which results in mydriasis. Next are muscarinic actions on glands. It stimulates the secretion of glands and thus increases salivation, lacrimation, as well as sweating via M3 receptors. Action on urinary bladder. It causes stimulation of detrusor and relax the trigone, increases micturition. Effects on GIT is increase in acid secretion in the stomach. It is stimulated by M1 and M3 receptor, and it also causes increase in peristalsis of GIT, and sphincters are relaxed by the cholinergic drugs, and it also increases the risk of peptic ulcer disease. Muscarinic action on bronchus. It causes bronchoconstriction. The action is mediated via M3 receptors and anticholinergic drugs, which may lead to bronchodilation. Male sex hormones. Due to vasodilation, the cholinergic system is responsible for erection of the male organ. Nicotinic actions at autonomic ganglia. Both sympathetic and parasympathetic ganglia are stimulated by ACH through stimulation of NN receptors. At neuromuscular junction, ACH stimulates skeletal muscle contraction by its action on neuromuscular junction. This is important classification how the drugs affecting the muscarinic activity. First are cholinergic drugs and next are anticholinergic drugs. Cholinergic, which are also called as parasympathomimetic drugs like acetylcholine, pilocarpine, these are directly acting. Next are anticholinergic parasympatholytic drugs. Receptor selective agonists. M1 blocker, pyranzepine, telenzepine. M2 blocker, triptyramine. M3 blocker, dirifenacin. Non-selective antagonists are atropine and hyoscine of cholinergic system. Now the drugs which act by other mechanism, that is decrease in choline uptake, hemicholineum, decreases vesicular uptake of ACH, vasamicol, decrease release of ACH by inhibiting the calcium mediated exocytosis, botulinum toxin. Thanks for watching.